congenital cardiac defect associations. So, for example, if we have a prenatal alcohol exposure, and that is what is also called fetal alcohol syndrome, the defect could be VSD, PDA, or ASD, that is ventricular septal defects, patent ductus arteriosus, or atrial septal defects, or just tetralogy of Fallot. So basically, a lot of things could happen. Also, if it's a congenital rubella, then it could be PDA, pulmonary artery stenosis, and septal defect, or septal defect actually. If it's Down syndrome, then it could be, the defect could be aortic valve septal, no, atrioventricular septal defect. Atria is the defect between the septum, in the septum between the atria and the ventricles. So atrial septal defect, atrioventricular septal defect, that is considered the endocardial cushion defect. So we already talked about this in embryology. If you go back, well, so this is the one that, oh, the one that is circled in red. This is the endocardial cushion, and it keeps developing by time. So it's this thing over here. So this is the thing that is responsible for the creation or contributes to the creation of the aorticoventricular of the atrioventricular septum. So it basically creates the septum between the two atria and the two ventricle. So as we said here, if we have Down syndrome, we could have a problem in or a defect in the atrioventricular septum. So that is why it's called endocardial cushion defect, because it's the source. And also in Down syndrome, we could have VSD and ASD. If it was an infant of a patient with DM during pregnancy, if the mother was diabetic, then we could have transpositioning of great vessels and truncus arteriosus, tricuspid tetraglia, and VSD. So for the Marfan syndrome, we could have mitral valve prolapse or thoracic aortic aneurysm and dissection. So thoracic aortic could have an aneurysm and could have as well a dissection with or aortic regurgitation. So for prenatal lithium exposure, we talked about this. It's Epstein anomaly. And for Turner syndrome, we could have a bicuspid aortic valve. It should be tricuspid actually, but it's not here. So it's becoming bicuspid aortic valve with or coarctation of aorta. If we have Williams syndrome, then it's supravalvular aortic stenosis. Just to know that Williams syndrome is a rare genetic disorder characterized by mild to moderate delay in cognitive development or learning difficulties. It has a patient with Williams syndrome could have a distinctive facial appearance, and oh, that's very nice, and a unique personality that combines over friendliness and high levels of empathy and anxiety. So a patient with Williams syndrome could have a supravalvular aortic stenosis. And also if we have 20q11 syndromes, like probably DiGeorge, what we said before, it could have a truncus arteriosus and tetralogy of Fallot. So that's for the congenital heart problems. Now we're going to get to the vascular system general problems. So hypertension is a persistent, so it means like it's chronic. It's not something that comes and goes. It just stays there for a really long time. So it's a persistent systolic blood pressure equals or above 130, and or diastolic blood pressure that is that equals or above 80. So it's basically this number. But actually we could have only this or this, so it's and or. The risk factors for hypertension, old age, increase in age, and then obesity, and then diabetes, and then physical inactivity, high sodium diet, excess alcohol intake, tobacco smoking, family history, incidence greatest in black more than white, and in white more than Asian populations. So all these risk factors are kind of well known actually. Just really expected for any patient with those to have a hypertension. Yeah, this makes sense. So for the features, 90% of hypertension is primary or what is called essential, and it's related to an increase in cardiac outputs or, as we say here, an increase in the total peripheral resistance. So it's either too much blood coming out of the heart or there is an increase in the resistance, that is total peripheral resistance. It's the resistance that the heart should pump against in order to get its blood into the vessels. So the remaining 10%, because we said like 90% of hypertension is essential, the remaining 10% is mostly secondary to renal vascular diseases. So basically it's related to the renal system. Renal or vascular diseases such as fibromuscular dysplasia, and it has the characteristic string of beads appearance on renal artery. So this is A. So this is a renal artery over here, and it looks like string of beads. There we go. Okay, so this is fibromuscular dysplasia. It's also usually seen in adult women and adult females, so that's where we see it. And atherosclerosis in renal artery, stenosis, or to primary hyperaldosteronism. So basically, these are the diseases that the hypertension could be secondary to. So first, we have the fibromuscular dysplasia that occurs in adult women, and it has the appearance of string of beads. And also the other disease is atherosclerotic renal artery. That's the other problem. Atherosclerotic renal artery stenosis. Okay, so it's just atherosclerosis in addition to it causing stenosis. And also it could be secondary, like the hypertension could be secondary to a primary hyperaldosteronism. Secondary to a primary hyperaldosteronism. So that's for the features right now. But for the hypertensive urgency, well, we have two type of problems. The first one is hypertensive urgency and then hypertensive emergency. So there is a difference between those two. So if basically the hypertensive urgency, it's a severe, the systolic blood pressure is equals or higher than 180 over the diastolic that equals to or above the 120 millimeter of mercury. This severe hypertension occurs like this huge numbers. This is a huge, definitely. So this number, if it occurs, but without acute end organ damage, like without a problem that is happening acutely and suddenly with very rapid deterioration in few organs. So that's just urgency, even though it's very high. But in case of hypertensive emergency, it's what's previously it was called malignant hypertension. This is the previous name that is not used anymore. So the malignant hypertension, it is a severe hypertension as well. It's a very severe hypertension as well, but with evidence of acute end organ damage. So something that is damaging acutely in the body, whether it was encephalopathy related to the brain, or if it's a stroke, or if it's retinal hemorrhages and exudates. So the retina could develop hemorrhages and or exudates. Also, the patient could have papilledema, could have myocardial infarction, could have heart failure, and aortic dissection as well, kidney injury, microangiopathic hemolytic anemia. That's cool. Microangiopathic hemolytic anemia and eclampsia. So all of these conditions are considered acute end organ damage, specifically because they most likely occur like immediately or acutely, or they don't develop just over time. They happen really quickly. So that's considered an emergency, a hypertensive emergency. What it says here that arterioles may show fibrinoid necrosis also as well. In addition to all of that, arterioles, like the very, very small arteries, may show fibrinoid necrosis. That's in response to hypertension. So, this hypertension could lead to more serious problems as well. Sometimes it just all of these happens acutely. That's a hypertensive emergency. In case it was a severe hypertension, like the patient comes to the emergency department and he is already with very high blood pressure. But in case he's not, in case he's staying at home, he's fine. That doesn't mean that he's fine completely, because the hypertension is predisposing to different diseases like coronary artery disease, left ventricular hypertrophy, heart failure, atrial fibrillation, aortic dissection, aortic aneurysm, stroke, chronic kidney disease, chronic kidney disease, which is also called hypertensive nephropathy, and also retinopathy. So definitely, I mean, predisposes to multiple diseases. Most of them are related to the heart and vessels, and also the major organ also that is related to the heart, that is the kidney. So we could have chronic kidney disease, which is also called hypertensive nephropathy, and also retinopathy. And that's it.